Okay, everyone, we will start this event. The Honorable Speaker, Professor Dr. Karnsunaphat, Balthip, PhD, from Prince of Songkla University, Thailand. The Honorable Vice Dean of Academic and Islamic Muhammadiyah Studies Affairs, Faculty of Health Sciences, University of Muhammadiyah Malang. The Honorable Head and Secretary of Nursing Science Study Program, Faculty of Health Sciences, University of Muhammadiyah Malang. The Honorable Head and Secretary of Diploma of Nursing Study Program, Faculty of Vocational, University of Muhammadiyah Malang, and all participants. Assalamualaikum warahmatullahi wabarakatuh. Good morning. Alhamdulillah, all praises to Allah subhanahu wa ta'ala for His blessing. So we all can gather here today without any obstacles. And to our beloved Prophet Muhammad sallallahu alaihi wasallam, who brought us to the light path, it is Dinul Islam. Welcome to the visiting professor by the team Community Nursing Roles in Adolescent Health Towards Non-Communicable Disease, conducted by the collaboration of Faculty of Health Sciences and Faculty of Vocational, University of Muhammadiyah Malang. So ladies and gentlemen, first my name is Olivia Fresca Dwi Marta, who will guide the whole session as a master of ceremony. And the schedule of today's event will be begun by the opening, continued by the Indonesian National Anthem, followed by Sang Surya, Holy Quran recitation, welcoming dance, opening remarks, plenary session of symposium and discussion, awarding certificate, and the last is closing. And ladies and gentlemen, and now let's sing the Indonesian National Anthem, followed by Sang Surya. Audiences are asked to stand up. and gentlemen, please have a seat. So the next agenda is Holy Quran recitation by Melanie Indrani. To Melanie Indrani, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. A'udzu billahi minasy syaithanir rajim. Bismillahirrahmanirrahim. Ya ayyuhalladzina amanu taqullaha haqqa tuqatih ولا تموتن إلا وأنتم مسلمون. واعتصموا بحبل الله جميعا ولا تفرقوا. واذكروا نعمة الله عليكم إذ كنتم أعداء فألف بين قلوبكم فأصبحتم بنعمته إخوانا وكنتم على شفا حفرة من النار فأنقذكم منها كذلك يبين الله لكم آياته لعلكم تهتدون. ولتكن منكم أمة يدعون إلى الخير ويأمرون بالمعروف وينحون عن المنكر. وأولئك هم المفلحون صدق الله العظيم والسلام عليكم ورحمة الله وبركاته.
Thank you, Melanie Indiani, who has recited the Holy Quran. May Allah always bless us. Amin. Now, ladies and gentlemen, to welcome our honorable guests and participants, we would like to present traditional dance by nursing students from University of Muhammadiyah Malang. The name of this dance is Topeng Malangan or Marks of Malangan. It is originally from Malang City, East Java. The dance shows the meaning of life and human nature, which can be seen from the combination of movement and character of the marks used in this dance art. So ladies and gentlemen, please welcome Topeng Malangan dance performed by nursing student from University of Muhammadiyah Malang. So, ladies and gentlemen, move to the next agenda is opening remarks. I would like to invite the Vice Dean of Academic and Islamic Muhammadiyah Studies Affairs, Faculty of Health Sciences, University of Muhammadiyah Malang, to deliver the opening remarks and also opening this event. To Mrs. Henny Dwi Susanti, PhD, time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahilladzi arsala rasulahu bil huda wa dinil haq liyudhhirahu ala dinil kullihi walau karihal musyrikun. Asyhadu an la ilaha illallah wa asyhadu anna Muhammadan abduhu wa rasuluh, amma ba'du. The Honorable Professor Dr. Karnsunaphat Balthip, I'm sorry if I spill with my speech, and the Honorable the Head Nursing Department and Secretary Faculty of Health Science, and the Honorable the Head and Secretary of Nursing Diploma Program Faculty of Vocational University of Muhammadiyah Malang, the Honorable the Lecturer and Staff Nursing Diploma Nursing Department, Faculty of Health Science, University of Muhammadiyah Malang, and my dear all of the students, welcome to our school. Firstly, I would say thank you for God, because of His we can stay here together and still healthy until now. Secondly, I would say thank you also for our Prophet Muhammad Sallallahu Alaihi Wasallam, because until now we can still to be Islamic and Muslim. Amin. And thirdly, I would say thank you so much for the Professor Balthip. Thank you so much for your coming. Thank you so much for your willingness come to our school. I hope you can enjoy it. And also, I think it's the weather very different from your country. Maybe it's very cool. I'm right. Yeah, I hope you still healthy and enjoy with our city. And also, I would say thank you so much for the committee member that already arranged this event very well and success. And also, I would say thank you especially for the head of nursing department and the head of diploma nursing. Is already initiative and motivate and help this event very well, because this means that they have plan and good idea, and also they are very seriously to increase our collaboration international. And also because that why we have this program or this event, especially about the visiting professor, that our second plan strategy of Faculty of Health Science, University of Muhammadiyah Malang, is international recognition between 2023 and 2026. That's why I hope with this event we can expand our collaboration, not just for the national. However, I hope we can collaboration with other country, and also I hope we can collaboration not just for academic, not just for visiting professor. I hope we can collaboration joint research with the Prince of Songkla University, Thailand. And I hope also we can collaboration not just for academic and research. And I want have collaboration with other fields, for examples like public health service in the community. And also with this event, I hope all of the students please listen carefully. Please pay more attention with her speech, with her material, because about that the Professor Balthip have a lot of experience, and please follow what her advice and what her experience, because that It means that you can increase your capability to be professional of nurse. And I hope also all of students can increase your competency. So it means you can to be international, you can to be competent in the international profession nursing. And also the last, before I close my speech, so let's we open this event by say Basmalah together. Bismillahirrahmanirrahim. Good luck all of you, and I hope you can may pay more attention with this event, and I hope all of you can follow it very well. Thank you so much. Finally, wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, the Vice Dean of Academic and Islamic Muhammadiyah Studies Center for the opening remarks. The next agenda is main lecture from the two guest speakers. The first speaker is Ms. Nurlailatul Masrurah, Master of Nursing Science from University of Muhammadiyah Malang, by the title Optimizing Family Nursing Care, Addressing Challenges in Childbearing Family. And also we would like to invite to our speaker from Prince of Songkla University, Thailand, Ms. Karnsunaphat Balthip, PhD, by the title Promoting Spiritual Health for Adolescent Involving Family and Community Health Nursing. Both lectures will be moderated by Ms. Indah Dwi Pratiwi, Master of Nursing. Ms. Indah Dwi Pratiwi, time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Okay, it's morning spirit, right? Okay, let me introduce myself first. My name is Indah Dwi Pratiwi, and I'm one of the nursing lecturer here in Muhammadiyah University of Malang. And I will be very glad to be your moderator for this scientific seminar. And before we move to our beautiful panelists here, let me first greet, so we have here around 250 nursing students coming from Bachelor Science in Nursing, and also our a nursing diploma who are in a second and fourth semester. And for bachelor nursing, they are now in sixth semester. And currently, they are taking major in community and nursing. Therefore, your expertise here is very good for them to be heard. And also we have around 90 participants who join online. So this is a hybrid seminar, and these 90 participants are coming from Muhammadiyah University. They are both nursing lecturers and also nursing students. Can we see the Zoom, probably, Pak Zaki? So our speaker here, let me introduce first for these two panelists. First of all, Ms. Acharn Professor Balthip. I'm sorry if I misspell your name. From Prince of Songkla University, Thailand. Welcome to our beautiful city of Malang. And also our second panelist here is Ibu Nurlailatul Masruroh, Magister of Science in Nursing. She is one of our community nursing lecturers, and she also graduated from Thailand. Yeah. Okay. So before we move to our first presenter, our first panelist, let's see her curriculum vitae. So this is, the first panelist is Ibu Nurlailatul Masruroh, and she is wonderful community nursing lecturers that we have. And she has a lot of experience in conducting research in community nursing, and especially in family nursing. And then she also granted some several research grant. And then I think I do not have to read all of the CV because there's a lot of things that we can talk about to Ibu Nurlailatul Masruroh. So before we move to our second panelist, probably we should start to welcome our first panelist to deliver her speech or her materials in family and childbearing nursing. Okay. Do you want to go to the podium or? Okay. Yes, please.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. How are you today? Alhamdulillah. Yeah. Okay. And the Honorable Achan Professor Dr. Karnsunaphat Balthip. Welcome to Indonesia. Welcome to Malang City. And Sawadika. Sawadika, yeah, okay. You know, Achan means teacher, yeah. In Thailand, we call our teacher with Achan, yeah. Achan, and all of the faculty member, the honorable of all of the faculty member from both from health science faculty and also from diploma from Fokasi. And then all of my dear students, both from diploma and also from Bachelor Nursing of Science. Alhamdulillah, I'm happy to be here. Given this opportunity to present you my topic that entitled Optimizing Family Nursing Care, Addressing Challenges in Childbearing Family. Excuse me? Oh, okay, thank you. Okay, and I would like to divide my talk into 3 main points. Next. The first point, the first section, I would like to describe you about understanding the childbearing family. And the second section about the challenges in childbearing families and strategies for optimizing family nursing care. And the last section, I will talk about addressing the unique needs of childbearing families and the role of family nursing in promoting positive outcome. Okay, and before we move forward to the next slide, I would like to ask you some questions, okay? Are you ready? Okay. Do you know what is childbearing family? Have you ever heard what is childbearing family? And why this topic is important for us? Okay, anyone else? Okay, I'll try to enlighten you by giving you some set facts or phenomena. Yeah? Okay, and I'll try to quote from UNICEF data on 2022. And the data is relevant with your age right now because I'll try to describe you that Indonesia now is ranked in 8th position in the world and second in Asia with the highest number of early age marriage. Early age marriage, ya, pernikahan dini. UNICEF noted that Indonesia was ranked 8th highest with an absolute number of child brides of 1,459,000 cases. And nationally, there are 11.2% of girls who are married under the age of 18 and 0.5% of these girls are married when they are 15 years old. This early marriage has an impact on the husband and wife being less prepared to carry out their duties as a parents, including accepting the presence of children in the family, so that a process that should be natural turns into a source of crisis for the family. And another sad fact that I tried to cite it from BKKBN on the last year said that now Indonesia have a baby born 4.4 million a year, and it means that almost the same with the population of Singapore. And the sad fact is more than 21% among them are being stunted. Okay. Various problems related to the impact of couples who are not ready to become parents, especially in the family childbearing stage, are also quite large, such as disruption of parenting patterns, children who are malnourished, mother who experience postpartum depression. So now let's figure out about the definition of childbearing family. Childbearing family is the stage of family development that begins when the first child is born until the child is 30 months old or 2.5 years old. Yeah. And it covers the period before conception, pregnancy, labor, birth, and the postpartum period. However, family childbearing nursing is not the synonymous of obstetrical nursing, which only consider the woman as the client and the family as the context for care. In contrast, childbearing family nursing consider the family as the client and also the family as the context for the care of its member. And childbearing family nursing primarily focuses on health and wellness rather than on procedure, the medical treatment. So in this period, it's very important because this family stage on the birth of the first child is a period of role transition. Okay, the key point is the role transition from new couple to be a parent, and it's not easy. Okay. So because it's not easy, so there are several challenges that arise from the childbearing family stage. As you see on my slide, there are the first challenging is financial strain. And the financial strain, economic pressure can happen because many families face financial challenges due to the costs associated with prenatal care, childbirth, and postnatal care. This strain can lead to stress and anxiety, impacting the overall well-being of the family. And also lack of access to healthcare. Because of limited access to affordable healthcare services can exacerbate financial strain and leading to disparities in the quality of care received by different families. And socioeconomic impact also happen because of financial difficulties can affect the family's ability to provide a nurturing environment for the newborn, potentially impacting the child development. And because of their role transition, so it needs a role adjustment also. Parental roles will changing. So adjusting to new parental roles, it's not easy because it can be overwhelming for both mother and also father, and impacting their individual well-being in the dynamic of the family unit. And adjustment also happen to the sibling, especially for the families with existing children. The adjustment of sibling to the new family dynamic can pose challenges requiring careful navigation and also support. And the partnership relationship are also changing. The shift in role and responsibilities within the partnership can lead to strain requiring open communication and mutual understanding. And about emotional well-being can be postpartum depression, because the emotional well-being of mother is a critical concern, with postpartum depression affecting a significant number of women. This can have a ripple effect on the entire family dynamic because family is a system. One of family member have a problem, so it can stimulate problem to another family member too. And stress anxiety, the transition to parenthood can be emotionally taxing, leading to stress and anxiety for both parents. This can strain the family's relationship and also interaction. Previous slide, please. Mr. Jackie, okay, thank you. And also the support system, lack of emotional support from family and friends can further exacerbate emotional challenges, highlighting the need for a robust support system. And access to resources, you know, that as a new couple, it needs a lot of support system. So education and information will be very valuable for them because it's crucial for family. It's need to give them a comprehensive information about childbearing and also parenting. And also another accessing community support system, for example, like parenting class, lactation support, and other essential resources will be needed also. And addressing the diverse cultural needs of childbearing families is essential, requiring access to culturally sensitive resources and also support services. Next. Okay. And another challenges that I will show you, based on the European Institute of Perinatal Mental Health, it's described about factors that have an impact on the mental health of mother during this family childbearing stage. And those are, the first challenge is almost the same with the previous slide, financial strain, economic and work-related problems. And then the other one is about stress during pregnancy, because mothers who are not ready for their pregnancy will experience that pregnancy will be a disaster that threatens the continuation of their life rather than accepting it as blessing or gift from the God. And another impact is worry or fear about the baby health of their own because of limitation of information or knowledge and also experience. And the fourth one is about traumatic childbirth, because they, or mother especially, will see the experience of undergoing childbirth as a painful event, so they will feel traumatic childbirth. And loneliness or lack of social support because of the changing in the status. It can be the mother feeling sad because he was cut off from the social life that she had before. So he will feel loneliness. And the next is problem in the family, especially based on violence, because both of couple with full of stress and anxiety will stimulate the anger and then try to hurt another couple. And pre-existing mental health condition. And adequate healthcare in this period should include attention to psychological factors as well as physical ones. Okay. And all of the health professionals who provide care during pregnancy, childbirth, and the postpartum should working together to solve this problem, especially for the family. Okay. Next. Another challenges in maternal health significant challenges for childbearing family, including pregnancy complication, postpartum depression, and maternal health disparities. It is important to examine the impact of these challenges on the family unit and also nursing intervention. Okay. And ladies and gentlemen, according to, next slide please. Okay, according to Duvals on 1977, that family developmental and life cycle theory, family changes occur in stages during which there is upheaval while adjustments are being made. What occurs during these stages is generally referred to as a developmental task. And so there are 9 specific tasks in this stage of family childbearing, and how well a married couple can adapt to changes in status in the family childbearing phase can be known based on how well they can carry out family developmental tasks in this phase. Okay. And the first task for childbearing family is arranging space or territory for a child. Okay. It means that how family or couple can provide the living area, physical preparation, and also material owned by all groups. And nurse can exploring thought, value, belief, and fears that may arise in preparation for the arrival of a baby, and have family to explore and manage their fears about their ability to maintain the baby's health so that they can then use resources to help them overcome them, so that the family's developmental task can continue. And the second task of childbearing family is financing childbearing and child rearing. And what the family health nurse can do, we can help the group to explore the resources needed, such as nutrition program, prenatal clinic, which are appropriate to the group's financial capabilities, and provide family with information and resources that will help them choose safe and appropriate childcare. And the third task is assuming mutual responsibility for childcare and also nurturing. Educating parents about the realities of parenting, such as sometimes when a new couple and get married, we just imagine how beautiful our life will be. Sometimes it's not, they not imagine, but there are reality about the life married, such as interrupted sleep because of the baby will wake up in the midnight, and change in how time is spent. So we can teach a family to alternate who respond to the baby's need. It's not just the mother responsibility, including feeding, changing the diaper, and also the comforting. Father can take the responsibility too. And assist parents to develop new skill in caregiving in ways of interacting with their babies. Observe the slight closeness between parental and baby by listening to what parents tell about the baby and paying attention to their behavior. Okay. And refer families who demonstrate behavior that is incapable of caring for the child to professional for intensive intervention. And the next is facilitating role learning of family member. We can help and encourage married couple to explore their attitude and expectation regarding their parents' role. Encourage parents to take parenting class, especially for parents who are isolated, for example, like married teenager, or from a different culture and living apart from their traditional network, for example, like their nuclear family. Because of living in the different towns, so it's need helping to adaptation. And encourage mother to invite their husband to share their physical sensation and emotional of being pregnant. How? You can put the hand of husband on top of your belly, the belly of pregnant mother, and feel the sensation of the moving of the baby. It will be the first bonding between the baby and also the father. and provide opportunities for father and other partners to become skilled infant caregivers. And number 5, adjusting to change communication pattern. For the family nursing intervention that we can give to the family is give parent health education about various baby characters or attributes so that they can able to interpret their baby's unique style of communication because baby communicate by crying. So we can identify wherever the baby is uncomfortable, feeling uncomfortable, and she will cry a lot, or when he sleep well, yeah, it means that he feeling or she feeling comfort. Promote effective couple communication by encouraging the partners to listen to each other actively, not just focus on your handphone. Encourage couple to set aside a regular time to talk and enjoy each other as loving partner. And the next task is planning for subsequent children, especially for the family with excess children. It's important to talk about what is the next baby will coming. Okay. Consider the family's culture and religious background and identify the power structure and how the decision-making process in the family, especially related to reproductive function. And we can refer to nurse genetic whenever needed, especially for assessment and counseling when appropriate. And number 7, realigning intergenerational pattern. Childbearing changes all the relationship and status in the family, within extended family especially. The parent sibling will be auntie and uncle, and children from previous relationship become step sibling, and our own parents will be grandfather and mother. Assist new parents to seek support from friends, family members, organize parent group, and work colleagues as a way to cope with the demands of parenting, and facilitate partner discussion about perception of extended family involvement in care of the new child. And the 8th task is maintaining family members' motivation and also morale. Provide information to family members about strategies for maintaining a sense of comfort, adequate rest and sleep, which will reduce feeling of fatigue, which has the potential to reduce motivation. Discuss with the family about the division of roles or responsibilities so that especially facing situations where the baby cries at night because of hunger or elimination. So we can spare the responsibility, especially between mother and father. Okay. And the last task for childbearing family is establishing family rituals and also routines. Determine the special cultural meaning each ritual has for the family and respect those meanings. Encourage families to carry out their usual routine and establish ritual related to their babies and other children. And we can facilitate a couple discussion of bedtime and bathing routines, a baby special position such as a treasured blanket, nicknames or language for body function, and welcoming rituals such as announcement or circumcision or other celebration to welcoming a new baby. Okay, so one more that I try to remind you that this 9 tasks for family childbearing is very important. So it will be the indicator how well a married couple can adapt to changes in status in the family childbearing phase can be known based on how well they can carry out these 9 family tasks. Okay. Next. Okay. And the impact of cultural diversity. Cultural diversity significantly influences the childbearing experiences, and nurses must be sensitive to the diverse cultural beliefs, practices, and traditions that shape the childbearing process. It is essential to discuss the importance of cultural competence in the family nursing care. Next. And we can also give supporting for the newborn health by exploring the challenges related to neonatal care, including prematurity, congenital condition, and the role of family-centered care in promoting infant well-being. Actually, the issue of infertility is also one of problems in the family childbearing. And promoting family-centered care, next, is essential for addressing the unique needs of childbearing families. Fostering open and inclusive communication between healthcare providers and childbearing families about the principle of family-centered care and strategies for engaging families in the care process. Promoting collaborative decision-making, it will stimulate empowerment in the family. And for addressing psychological need with mental health support. Next. Including the postpartum care, implementing comprehensive postpartum care program that include mental health screening and also support service. And we can give also counseling services by providing accessible counseling services for parents and families can offer a supportive environment for addressing stress, anxiety, and emotional challenges. And peer support groups, by facilitating peer support groups for parents, can create a network of emotional support and shared experience promoting mental well-being. Ladies and gentlemen, as I told you before, that family childbearing stage is include a crisis event in the family life cycle because of there are changes of status. So we need crisis intervention and creating supportive environment for the family who in the childbearing stage. Next. For example, like giving a physical comfort during the delivering process, creating a supportive and comfortable environment within healthcare facilities for childbearing family, acknowledging and significance of the birthing experience. So birthing experience will not stimulate the trauma for the mother. And emotional support by providing emotional support and reassurance to families throughout the childbirth process, acknowledging the emotional significance of the journey. And the most important is family involvement, encouraging all of the members of family to actively involvement in decision-making and care processes, recognizing the importance of family support in the childbirth experience. Next. And to be strength and resilience, so it will need empowering and advocacy of the family right. So self-advocacy skills by empowering families to advocate for their needs within healthcare setting, promoting a sense of agency and active participation in their care. And also need community engagement, encouraging families to engage with community organization and resources, fostering a sense of empowerment and active involvement in societal support system. And policy advocacy also needed for supporting families in advocating for policy changes and improvement in maternal and child health care, empowering them to drive systemic changes. And then we have to evaluate all of the intervention that we have applied. Effective evaluation is essential for assessing the impact of family-centered care intervention. We can evaluate strategies and also outcome measures to ensure that nursing care meets the unique needs of childbearing family. Remember that every family have their own characteristic. So that's why it will need the unique needs of childbearing family. Okay. We have to recognize the unique characteristic in each of family. Okay. And finally, as the conclusion, optimizing family nursing care for childbearing families requires a holistic approach that addresses physical, emotional, and also social needs. By understanding the challenges and implementing family-centered strategies, nurses can make a significant impact on the well-being of childbearing family. Okay. I think that's all my presentation today. Thank you for your attention. Hoping it will give benefits for you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Ibu Nurlailatul Masrullah. Let's give one more round of applause for our first panelists. Okay, before we move to question and answer session, please hold on to your questions. Take notes because we do question and answer session after we finish our second panelist. So are you ready? Yes. Yeah. Okay, please welcome Ajahn Professor Balthip. Okay.
So you can see. Thank you very much. Swadika. Good morning. First, good morning. Oh, very nice voice. So you are alert and ready to learn more? Yes. Okay. First of all, I would like to say thank you from UMM that invited me to be here. Although we have a very brief conversation, but I can be here today. And on the first day that I arrived, I feel very warm of your welcoming. So thank you very much. And I have opportunities to discuss with some lecturer here. We can see the possibility of the collaboration, like the Vice Dean mentioned this morning. So not only today I'm here, but I hope in the future we can have more collaboration in terms of academics, research, and international affairs. Do you students want to go to PSU? Do you want to go to Thailand? Yes. So really hope to see you all there. Okay? Actually, I should inspire empowerment rather than give a talk, right? I don't want to follow my talk right now. I want to talk to you more. Okay. Are you ready for my talk? Yes. Ready? Actually, I have only 1 hour. Not enough? Can I talk until 1 p.m.? No. Okay, I understand. Okay. So for this topic, I will talk about. Give me my slide, please. Should I? Okay. Actually, I prepared 2 PowerPoints, but because the topic about NCD, so today I will start with the NCD first with you. Spirituality is important to adolescents, but today we talk about the roles of the community nurse in preventing NCDs for adolescents. Are you adolescent? Are you? How old are you? 14 years old. Okay, I'm sure you are adolescent, and we will discuss about the topic that very, very close to you, and you may, but I hope not, you may not have NCDs, okay? Okay, so, okay. May I go down to the, close to you? Yeah. Okay, good. Okay. I hope. So today we will talk about non-NCDs, right? Non-communicable disease. Very nice to see your smile. Close. Okay. In Thailand, in my faculty, my student call me Ajahn O. Ajahn is mean lecturer or teacher. O is my nickname. So easy, right? Okay. Okay. O, Ajahn O. Okay. So I have around 1 hour. I start from around 9 a.m. to 10 p.m. Okay? 10 p.m. No. 10 a.m. Okay. I'm sure you not sleepy. Okay. So today we will talk about NCD. Do you know what is it? Do you want to have it? Do you want to? Yes. Do you want to have NCD? No, right? No. Could you please give me an example of NCD? What are the what disease when we talk about NCD? Help your friend. Help your friend. We talk about hypertension, right? We talk about high cholesterol. We talk about diabetes. Anything else? Stroke. Oh, very smart. Put your hand together for your friend. Give a big applause for her. Very good. Ajahn. Okay, when we talk about NCD, we think too many diseases such as DM, hypertension, cholesterol, anything else. So I'm sure no one wants to have it. Correct? Yes? Yes, because NCD is a chronic illness. Once we got it, it's not easy to get rid of, right? And also it has a long duration of complication. Do we have to take a lot of medications? If our patient has NCD, do they need to take a lot of medications? Yes, I saw my patient. One of them have 7 kinds of medications. Sometimes they forgot. Do you think if you have to, why? If you have to take 7 medications, sometimes can you forget it? Can you forget to take it? Yes. And another thing about NCD is, when we talk about NCD, it is the result of a mix or a combination of many factors. For example, our physiological dimensions, our environmental dimension, and the last one, but it is the most important of having NCD is about your behaviors, right? Yes, do you agree? Could you please give me who want to answer my question? I will give you a long can. if you can answer, could you please give me some answer? What are the behavior that might related to the NCDs? Raise your hand, please. What are the behavior that cause the NCD? Oh, I saw her speak like this. She said, lack of exercise. You agree with me? Yes. And then what else? What else? Exercise. She said that consume of junk food. Correct? Yes. Lack of exercise, consume a lot of junk food. Did you have junk food this morning? No. What did you have this morning?
Rice.
Rice is good or not?
Good.
Good. Oh. Very good. Rice with what?
Noodles.
If noodle only, is it good? No, not enough. Noodle with what? Beef, meat. And what else? Noodle, vegetable. How much? Much. Okay, much. And also because very much, right? Very much. So if we have the behavior like that, don't eat junk food, do some exercise. How often should we do exercise? How many days a week? 3 days a week. For how long? At least 30 minutes. right? So if our patient, our population do that, we may prevent the NCD for them. However, I have a big question. Not I mean everyone have a big question. Why? It's easy, right? To sleep enough, do exercise, eat a good food. You may have PA, physical activities. But why people don't do it? Why people don't do it? This is a big question. So we will talk later a little bit more. What should we do as a nurses? As a nurse, what should we do to enhance the health promotion behavior for our client? Okay. Actually, we can change. We cannot change the what genetics. We cannot change some demographics such as sex, male or female. Female or male prone to have NCD. Male or female has more opportunity to get NCDs. Male, a woman said male, male said female. So actually some kinds of NCD, female most likely to get NCD. But for some male, right, why male more likely to have NCD than female for some disease such as hypertension or diabetes or obesity? Why male has more opportunity to get NCD? Because they smoking and drinking, and nowadays women have to be careful too, because you may close to your husband, neighbor or family members who have smoking, and you can get the second hand smoke from the partner, right? The person who next to you. So nowadays I think maybe we have to change the text, the knowledge, because the possibility of being NCDs, everyone can get it. Okay. Oh, sorry. Okay. And do you know why NCD is important? You can see the big figures or the number of NCD. They said that around 41 million die because of NCD. Is it big? 41 million. Oh. And 17 million die from NCD before 70 years old. How long do you want to live? How long do you want to live? How old?
100.
100. Okay, good. She said 100 years old. However, once you have NCD, is it possible for you to live until 100 years old? No, because NCD can kill you before you are 70 years old. So we have to prevent, right? We have to prevent, and we have to tell our people too, you should prevent if you want to live longer with your family members. If we want to, she turns her face somewhere. I don't ask her, sorry. Okay. If you want to live longer with your family members, if you want to live longer with your parents, if your parents want to live longer with you, they have to prevent NCD. Otherwise, you cannot live longer because a lot of people die before 70 years old and sometimes 35 years old. Have you heard that someone died because of NCD at around 35 years old? Yes, right? Because they have stroke sometimes, like your friend said, they have stroke and paralyzed and not very long. They cannot live because they have pressure sore, they can move, they can speak, they can eat, they have to have the respirator, right? And they don't want to live. Okay? Because actually when we talk about NCD, not just the physical problems, but it is related with the psychological problems and spiritual problems. Like you are healthy, you want to live for your friends, for yourself, you want to have a beautiful life. But once we get NCD and we have to have bedridden, you think every day you feel blue, you feel sad, or you feel happy. sad. You may not want to wake up. Once you have a psychological distress, it may affect to your physical health, and you may not want to live, right? So that's why prevention for NCD is the most important, because once we get it, it's not easy to eradicate from our body, and it's not easy to care and kill. However, as a nurse, as a nursing student, we have a role to care of the patient like that. Actually, I told your teacher that I graduated my master's degree from adult nursing. It means a nurse who are working in the hospital. But once I work at the hospital for a long time, for some times, I think, what should I do to prevent the patient don't come to the hospital? So I think it is better to prevent and promote rather than care and treatment. So that's why I turned myself to work in the community. Like your lecturer said, that work with the families, with the community, because if we prevent, we provide enough education for the patient, we empower them to do care for themselves, they may not get the disease. Do you think nurse is important? Yes, very much. Do you think nurse is important? Yes, yes, right. Not just only yes, 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 yes. So this is the risk that we have discussed: tobacco, lack of physical activity, harmful use of alcohol, unhealthy diet, and sometimes what is air pollution, right? When we go out from the building, a lot of smoke from the car, from your friends who smoke, something like that. Who smoke? Don't raise your hand. Okay, okay. So the main point that we have to do is we have to have the detection, we have to have the screening, and also the WHO talk about palliative care. It means when people have severe disease and may not be able to treat and cure, we have to prepare them for palliative care. But for me, even though I'm interested in spirituality, but when we talk about palliative care, I think we don't want to meet it, right? We don't want to face it. So it's better to detect, screening, and promote health. Okay. Do you understand? Do I talk too fast? No. Okay. Thank you very much. Okay. I need your answer, though. Okay. You ready to participate with me? What is the nature of NCDs? When thinking about patient with NCD, what do you think about it? Anyone raise your hand? Help me, please. When we talk about NCD, can you imagine who are they and what are the symptoms do they have? What are the symptoms? What are the feelings? What are their behavior? What are their accommodation? What are their environment? Anyone can help me? Do you think do they comfort? Do they feel comfort? No. Do they feel pain sometimes? Do they sleepless sometimes? Do they have to rely on others? NCD patients, do they rely on others sometimes? Do they need someone to take them to the hospital? Do they need employment? Do they need mental support? Yes. So with NCD, actually you can see her foot has a wound, have to come to the primary care center every day. This is they give me the permission already so that I can show them. Do you see the house? Is it good for ventilation? Because she has asthma. If her home like that is okay? No, right? So when we talk about NCD, it has many problems, many causes that make them to have like that. And again, once they got it, they may face with so many problems. Does it move? Okay. Next slide, please. Maybe the battery. Okay. Again, I would like to ask, do you think how does people feel about being diagnosed with NCD? Do you feel glad? Do you think that they feel glad? Happy? No, right? They may feel sad, shocked. Oh, they may feel shocked.
Yes.
Sad. Why me? Right?
Yes.
Oh, why me? Am I doing wrong? Or maybe God punished me, right? They may say things like that. So when we talk about NCD, I think I never see patient feel happy. But actually, as I read and I wrote a book about NCD care for patients. Actually, when they have NCD, they can have a normal life and happy life if they look after themselves very well. Okay. However, today we will focus on prevention. Okay. Okay. And now, in the first part, overview about NCD in general. But now, close to you now, NCD disease and youth. Sorry, actually, they said that impolite to ask age. How old are you? Today, I would like to be, not, I will impolite. How old are you?
21.
31. Is it adolescent or youth? Youth, right? So, this topic very close to you now, so help me, okay? When we talk about adolescent or youth, normally, if adolescent, it means 10 to 19 years old. But when we talk about youth, it means around 15 to 24. And this group of people are likely to have NCD right now. Do you know why? Do you know why? The behavior, for example, play the games in front of the computers. Yes, and lack of exercise. Do you see them play football a lot right now? Outdoor activities, do they have a lot right now? No, right? Oh, they feel hot. Better to stay inside, play computer games, right? Okay. And what else? Why? And how about the food that they eat? They eat KFC, junk food, fried chicken, and McDonald's. Yes. And what else? Not sleep well. What time do the young people go to bed? 2 a.m. Yes, I agree. 2 a.m. to 3 a.m. after midnight. If we have the pattern of sleep like that, is it possible to have NCD? Yes, but you know, for me, before I came here many weeks ago, I have a lot of work. So I went to bed after midnight. So I'm like a young person now. But I'm risk in get the heart disease. I think one day I may die with the myocardial infarction. No, right? I shouldn't do that, right? Okay. So with youth, because of several factors that make them to have that kind of behavior, so they have more risk nowadays. And actually, I showed this. Don't worry about the small part of the letters. I just would like to tell you that one size of youth, it is a positive size because youth has the growth and development, fully development in terms of physical, psychological, and their spirituality, right? Adolescent and youth have a fully development in terms of holistic, both physical, psychological, and spirituality. However, in some part, they may not be able to look after themselves because of several things, several factors that influence them, like their friends. If you have a good friend, they may ask you to go for a walk. If you don't have a good friend, they may ask you to have a hot pot. Do you have hot pot a lot in Indonesia? Barbecue, grilling. Oh, every week. Have you been there every week? No, because you don't have time. Okay, so if you have a good friend, your friend will ask you to drink water, but If you don't have a good friend, my friend good. What did he do for you? What did he do for you?
He invite me to pray and study together.
Oh yes, I forgot something about praying. Prayer is important, right? Prayer can make you have a calm mind and have the concentration. Once you have a calm mind and have concentration, you can learn very well, right? So you choose the right choice. Your friend asked you to pray and study, and did you do that? No. Yes. Oh yes. Very good. Okay. So if this is the thing that we talk about, the factor related with the NCD. And also we also talk about the impact, right? If we have NCD as adolescent, we want to live for at least 70 years old. If we have NCD, what will be effect to you? If you have DM, can you study well? If you have NCD, if you have DM, can you study well? No. If you have DM, how your family feel? They feel sad. They have to look after you. Afraid of what? Very good. Actually, if only one, I will stand here first. If only one person get NCD, that person also feel very stressed, afraid, sad, depressed, shocked. But not only that one person, the other person related to them also will be affected by their diagnosis, right? Like their family members may be sad too, feel shocked too. What should I do to help my daughters? Okay? And then society, you think if a lot of youth get, oh, I'm hungry too. If a lot of youth have NCD, do you think it will be effect to your society? We don't have a good population to be a good power, for our society. If a lot of children, a lot of youth have NCD, our family, our society may be collapsed. You agree with me? Indonesia may not be able to improve. Indonesia may become a developing country, not a developed country, because the youth who are the important person will lack of energy to move on their countries. Do you agree with me? When we look at the pyramid, when we look at the pyramid of population, the adolescent in the middle, right? And if in the pyramid, can you imagine the pyramid like this? If you pyramid like this and adolescent here, if they are not healthy, your country will be able to develop well or not? No, right? Yes, so you are important. You have to look after yourself very well, both physical, psychological, and spirituality, to be able to the power of your nursing profession, to be the power of your countries, to be able to help others. Okay? If nurses are unhealthy, can we help others? No. If we get disease, it's not possible for us to help others. So as a nurse, as an adolescent, as a youth, you have to look after yourself very well, because you are very important. Okay? Do you think you are important? Yes, sure. Very good. So what community nurse should do to prevent NCD for youth? So now come back to our nursing profession. What should we do to prevent NCD for youth? I will go quick now. Ajahn lecturer talk about family nurse already, so I will brief a little bit for this discussion. Actually, nursing, family nursing, not just only take taking care for one patient, but we also taking care for two person in the family, and the last one we taking care for the entire family. So this one is important because when people get NCD, not just because of their own behavior, but actually it related with their family behavior as well. If your mother cook vegetable, do you eat vegetable? If your mother cook junk food, fried chicken every day, do you eat fried chicken? Yes, so that's why as a family members, as a family nursing, we normally don't look after only one person, but we look at the entire family because each person will influence each other in different ways, okay? So that's why as a family nurse, we care for the whole or the entire family. And because no one can live alone, so this is another statement to mention that as a nurse, as a family nurse or as a community nurse, we have to look after the entire family. We cannot just only focus on only one person. Naka? Yes. And this is the roles. Actually, I asked teacher, what do you do? What do you do when you are taking for the patient? Do you use the nursing process? Yes. What are the components of nursing process? The first one, assess. The second one, diagnose. The third one, planning. The fourth one, implementations. And the last one, evaluation. Yes, I think nursing process is the most important. It is a scientific process. Before we care for anyone, we have to assess them first. What do they think? What do they perceive? What do they do? After that, because one person, the first person and the second person, do they need the same thing or not? No, each person have their own unique. So before we care for the patient, we have to care for them as a unique person, okay? So we have to assess, we have to diagnose, we have to plan, we have to implement, and the last one we have to evaluation our action, okay? This is the same of the role of nursing. And do you have this? This is the age characteristic of public health nursing. We have, as I told you, we have to care for the whole family. We have to have the good collaboration with our patient. If we don't have the good collaboration with our patient, do they will trust us or not? I think if we don't have a good rapport, we don't have a good collaboration, the patient never listen to us. They just smile with us, but they don't follow our suggestions. So we have to have the good collaboration. Our patient and us, we should be like a partner, not boss and servant, not boss or supervisor. Okay, we should be a partnership. The patient has their own education, has their own knowledge. We have our own knowledge, but how can we collaborate to each other? Okay, the most important. And the last one, in the community, the most important thing is we have to prevent more than treatment and cure. We focus on prevention because with prevention we use a small money. Prevention, our patient doesn't feel burdened or burn out. The caregiver still feel okay. But if we focus on disease, it's too late. Okay? We need to promote and prevent. Okay? And we try to find the best strategy to deviate, to change the behavior. We have to find the best strategy to enhance the quality of life, to enhance the good behavior of the patient. Okay? And the last one, don't forget, I think each family, they have their own resources. We have to look at their resources and use that resource to empowerment them to care for themselves. No one can care for the patient except themselves. What do you talk about? Delicious? Yes. Okay, I just tease her. Okay. So when we talk about the patient, the care for the patient, no one can care for them except themselves. But the role of nurses is try to empower them to take care of themselves. Okay? What should we do? We should empowerment them to care for themselves. We have to help them to see their own value. Okay? The first thing, we have to help them to see their own value. After that, we and our patient have to set up the strategy to enhance their health and well-being. After that, you can see the first thing, set the value, find the value of the patient. After that, set the strategy together to enhance their health and well-being. After that, we have to mentor. We have to be the mentoring. We have to follow them and empower them, inspire them to care for themselves. Do you think if one patient has blood sugar 150 milligrams, is it easy to decrease to 110? If this patient, if this patient has blood sugar in their blood 150, what is the normal of blood sugar in the blood? No more than 110, right? In approximately. If nowadays she has 150, is it easy to decrease? No. That's why we have to talk to them. The first thing, could you please tell me about the good thing in you? Could you please tell me what should you do to decrease your blood sugar? So can we plan together? What should we do together? And after that, she said, okay, I will eat less starch, eat less rice. I will start to eat more vegetable. Okay, very good. When do you want to start? She said, I will start tomorrow. But tomorrow never come. Tomorrow never come, right? So we have to tell the patient, will you start from now? Could you please start from today? Yes. For dinner? Yes. Okay. So she will start from today, right now with us, and tomorrow we come back again. Hi sister, yesterday we talked about this. What do you do? What is happening after you do that? How do you feel about that? Okay, and the next week we come back again and inspire. Wow, you can see you have a very good health now. Let's see your blood sugar. 1 month passed. Let's see her blood sugar. Wow, sis, you can see, sister. You can see your blood sugar decreased from 150 to 159. No, to 139. So if the patient see like that, do they have the eagerness to move on? Do they want to move on if like that? And sister, should we wait together? The sister from 59 kilograms, now her weight go down to 57. Do you think she has a hope? Yes, if like that, it's good. So after that, we have to evaluate. Can you see? The first thing, find the good thing in the patient. The second thing, set the outcome together. What should we want? What do we want? Okay, minimize the blood sugar, lose weight. The third one, we have to set a plan together. Do exercise, eat more vegetables, sleep well, something like that. After that, allow her to do the thing that we plan together. And we visit her once a week, twice a week, or every 2 weeks to monitor. And then evaluation. Easy? the most important thing is try to find their self-value in herself. When we care for the patient, we are not the main actors, but patient is the most important actors. We have to encourage them to do for themselves. I like you, I like her. She tried to comfort me, so she empowerment me. So when you look at people who empowerment you, you want to talk more? You want to do something good? You can see when you look at the patient and you put your energy to them and they reflect back with a positive way, we want to do more. Thank you very much. Would you like to say something? Please. No. No. Okay. Next. I have to talk fast now. Okay. This is the nursing process that we always familiar with. We have to assess, we have to plan, we have to implement, and don't forget to evaluation after we implement the nursing care. After we provide the nursing care, we have to don't forget to evaluation. Okay? Okay. Again, I have discussed what should we do to enhance the self-care for the patient. Find the self-value in the patient. Right? We have to looking for the good thing. Although the patient, you may thought that, oh, I cannot find a good thing from the patient. But if you look at her closely, I'm sure you can find. Even the person who smoke, you think can you find a good thing from the smokers? Do you think can you find a good thing from the patient who smoke? No, right? But actually, if he is a man, is a leader of the family, he is the most important person who earn money to the family. Can you find a good thing of him? Yeah, so everyone has the good thing. So when we start to talk with anyone, if we start with the bad thing, do you think the patient want to talk to you? No. But if you start to talk with them with the good thing that they have, do you think they want to talk to you? Yes, correct. Okay. Again, when we talk about assessment here, actually we have so many conceptual framework to use. For example, family structures, family growth and development, family like that. And one thing, today I would like to tell you a little bit about determinant of health. When we talk about NCDs, we have to know the factors that related with the NCD of that patient. Why do they have NCD? We have to start from themselves. What is their sex? What is their education? What is their belief? What do they believe about food, right? Because I heard, is it true? Tell me, is it true? Is it the truth or not? When Muslim women do exercise, they have to wear clothes very, very properly, right? And some activities they cannot do with the male. Is it correct? Yes. So this is the belief. So as a nurse, once we know the belief, we shouldn't set male and female do exercise together, right? So that's why I said that when we want to enhance the behavior of the participant, don't forget to ask about their knowledge, their attitude, their belief. Okay, the first thing. The second thing, you have to ask them about their physical, their activities, their walking, their learning, something like that. And the next one, do you think community is related to the NCD? If in your community sell a good food, the people has more opportunity to buy a good food, is it related to the health? Is it possible to prevent NCD? Yeah. Yes. Okay, so next we have to look at the community environment. The first thing, have to assess the person. The second thing, have to assess about their activities, their family related to them. The third one, have to look at the community. And the last one, you may have to consider about their economics. This is the belief, this is the knowledge. They said that the person who have low income may have less possibility to get the good food. Do you agree with this sentence? The people who have low economic status, they have the less opportunity to get a good food. Do you agree that? 5 gentlemen here, do you agree with that? If people have less money, they have less opportunity to get a good food. Do you agree that? Do you agree with that? No or yes? No, he said no. Who said no? Who said no? Raise your hand, please. I ask another time. If people have low economic status, they may have less opportunity to get a good food. Do you agree or disagree? Anyone who agree, raise your hand. Agree, raise your hand higher, please. Yeah. Who disagree? Who disagree? Actually, it is true both. Nowadays, actually, I wanted to say poor people, okay? Poor people, they may have around 100. What is the name of currency of your country? Indonesian dollars. Indonesian.
Yes.
If they have only 10,000 Indonesian rupiahs, do they can buy a good food for 5 family members? No, they can buy a rice and then something else. But if they have 1,000 rupiahs, they may be able to buy more good food. Okay. However, nowadays it's not true. I'm sure you have money, but you may buy fried chicken, right? So nowadays the knowledge may be changed a little bit because it is related with the knowledge and education. Okay. However, we still think that low economic status has more risk to get not a good food. Okay. Okay, I will move. Oh, how many minutes? I have 10 minutes. So, okay, when we talk about behavioral modification, when we want to change behavior of the patient, actually I have discussed a little bit previously, but as a nurse, I would like to mention that as a nurse, we have to use nursing process together with some concept to prevent, because actually we have so many models to promote NCD. Oh, sorry, not promote, to prevent NCD. Have you heard about TTM? Have you heard about MI? Later you will hear about it. Have you heard about health belief model? Yes? Oh, good. Have you heard about self-management? Actually, everything there try to help the patients to see their own value and take their value to change their behavior. Today we have a limitation of time, so I may not focus on that much. But the last one, did you see the yellow one? Have you heard about purpose in life? Yes? Yes. And also myself, because I interested in spirituality and purpose in life. And I'm sure that if, I believe that if people have purpose in life, they may behave, they may act in the right way. Once people have purpose in life, they have a good behavior, they study hard, they do activities, they want to have a good careers, to care for themselves and to care for family members, something like that. If people have purpose in life, they have a very good positive life part. They act well, they behave well, they have a good activities, good behavior. So I believe in that. Look at here. This I will move on, okay? Just to tell you that before we want to enhance any behavior, don't forget to look at the perception of the patient. Try to take the good thing that they have, try to find the value that we have to inspire them to change their behavior. Okay? Try to inspire them to change their behavior. We have to motivate them to change the behavior. Our role is not change their behavior, but motivate them to change their behavior. Okay, I would like to focus a little bit about purpose in life. Actually, I would like to stop here now a little bit. So, what is purpose in life? Could you please step back? Deep breath. I would like to tell you 3 components of purpose in life. The first one, you have to have intention to do something. Do you have intention to do something? The second one, you have to have action to do that thing. The first thing, you have intention first. The second one, you have to have action. And the last one, the action should be good for others. This is the characteristic of purpose in life. The first thing, you have intention. The second thing, you have action. And the last one, that action have to be good to others. This is the purpose. Do you have it? Do you have intention to do something? For example, you have intention to study. And do you have action? Do you study hard? No. Okay. Because if we just only have intention and without action, we call dreamer. Okay? And if we have intention and we have action, but action only for oneself, we call dapper. But the person who have purpose in life should have 3 of them: intention, action, and the action have to be good for others. Do you think it's possible? It's possible to think about others? Why do you study nursing?
I want to help each other.
You want to
Help
help
each other.
others. Oh, big applause for him. Ah, he said that he want to study nursing education because he want to help others. So, from his answer, do he has purpose in life? Yes, because he has intention to be a nurse. He study hard. It means his action. And the last one, the action is good for others. And one thing that I want to mention, once we want to do something for others, do you feel happy? Yes. So this is the truth. Although we want to do something for others, the first person who feel happy or fulfilled first is ourselves. The patient did not receive any good care from us yet. But once we want to do a good thing from others, the first person who feel happy is ourselves. So purpose in life, this is the reason why I like purpose in life. Okay? So if you want to use purpose in life to prevent NCD, the first thing you have to ask them the most important thing in their life. Like him, he wants to be a nurse. It is the most important thing. Okay? After that, explore the value of himself. Ask him, could you please tell me about the good thing in you? Okay? The first thing, searching the most important thing in his life. The second thing, explore the value of himself. What do you have? The value that you have. The third step, setting the life goal. What is his life goal? To be a nurse. He wants to be a nurse. Number 4, decide the life path. Decide what are activities to achieve the life goal. What are the activities to be a good nurse. And after that, acting it, do it. Okay? If you use this step to guide your life, I'm sure you will be a good nurse. And you will be the person who will be able to look after others. Do you want that? Yes. So this is one thing that you may use with your NCD patient too. Ask them what is the most important thing in their life. Explore the value within themselves. After that, set the goal together and set the plan. What do they want to do? And ask them to do it and you inspire them all the way to go through. And don't forget to evaluate the happening at the end. And this is the thing that they will find their purpose in life. Give me another 3 minutes, okay? 3 minutes. Could you please write down, everyone please, okay? Everyone please write down the most important thing in your life, only one. Please write down, in your paper, please, write down the most important thing in your life, only one thing. Please do. I will give you 1 minute. Okay, did you hear me? Write down the most important thing in your life in the paper, please. Okay. You don't have paper? Write down the most important thing in your life in the paper, please. Or in something. Okay. Are you there? Okay. I give you 1 minute. Finish? Very good. Actually, I have another PowerPoint, but I don't have time to show. Actually, I ask you to draw a heart shape and write down the most important thing in your life into that heart shape. And then we will do things more. Okay. 3 minutes will be finished.
You still have probably 15 minutes more.
Oh, thank you very much. Okay. So far, you understand my talk? Yes, yes. You said, oh, Ajahn, teacher walk a lot a few days. She laughed because she think like that. Teacher, she think like that. I walk a lot, she feel dizzy. Okay, ready? Can I ask two representatives from this class, one male and one female, to stand here and tell your friends what is the most important thing in your life? Who want to share? Yes. Very good. Ajahn, I have to give something for her.
Yes,
Because she is a
we
best
do have.
student. You do have?
Yes,
Wow.
we do have a prize.
Oh, okay, here. Very good. Okay, very good. Okay, and before your women friends start, I need another one. Male, please. Yeah. Ajahn Saki, please. Yes. Male, please. Ajahn, because you are male, so I don't want to talk. Actually, at my faculty, female has a lot more than male. So I always say female is the best. Do you agree with me?
Yeah?
Yeah, female is the best. A male, please. One male, please. Oh, good. Put your hand together for him. Okay. So my question is, so are you ready to listen to your friend? Oh, take off the cap. He wants to be there. Oh. What is your second year or third year? What the years that you are in now? Third year. And the you are classmate. Yeah. Oh, classmate. And how many years to go? How many years to graduate?
One more again.
One more year. Today, I think I come in the right time because it is a graduation day, right? It is a graduation ceremony. So I think once student here see your senior friend who are graduate, you may have a more inspiration. A lot of people, a lot of students are very beautiful, and I can see their family members has a very big smile, right? You think next year you will graduate too? Amen. Yes. Okay. My question is, today only one thing. What is the most important thing in your life, and why? Every time when we ask about the most important thing to the patient, we have to ask why. Because why will help nurses to plan what should we do to enhance their purpose in life. Okay, it's time for you.
Oh my God.
Put it together again for your friends.
just one. My important in life is my parents because they love me and I love them. Yeah, just it. I mean like they trying to make me nurse school. What? Sorry. Yeah, make me being a nurse so I can help all of people or a lot of people and can take care of them in their old age.
Yeah. My important people for my life is only my mom. Yeah. Uh, if we call about the parents, I don't have daddy anymore, so I just call it my mom. Yeah. When my mommy said, I will do it, and my mommy said, if you just want to be a more grateful life, you should be a nurse. So I just do being a nurse. Yeah.
When I would like to, stand in the middle because they are 20 years old. He's 70 years old. He is 21 years old.
I'm still 20.
20. Because 21, 20 plus 40, 41. 41, right? I'm 52. So I have to be interview them. Make me younger. Okay. Okay. So very good. You can see both of your friends has someone that is important to them. And once they have parents, he has mom. Both of them inspire them to study, and once they graduate, they will have a good life. Do you think your parents want to see you have a happiness or sadness? Happiness. That's why the most important person in our life, apart from God, okay, it is our parents who always love us with unconditional love, right? So I'm sure if you have this kind of thing in your life, you will have a very beautiful life. Okay. So if I say 3 components of having purpose, the first one, intention. Do your friend have intentions? Yes. Do they have action? Yes. And do their action will be contribute to a good thing for others? Yes. So again, put your hands together for them. Thank you very much. And I wish you both of you all the best. Okay. Thank you very much. Yes. Yes.
Ajahn O, we have a gift for the students. Would you please to give?
You have a key. Wow. You will. Ajahn, yes. Yes. Okay, I will take back to Thailand. Okay. Okay. Back to slide a little bit. So I'm sure because we have male and female as a representative from your class, and I'm sure all of you are the same. Are the same, right? Are the same in terms of want to be a good nurse, to help others. And when I came here, I received so many things that I impressed. You know, another thing that I impressed is your friends and you, very brave, have a very fully attention. And the most important thing is you have a very fluent English speaking. Very good, very good. Okay. Shall we go back to slide a little bit? I will end my talk in, okay. So, okay. I want to, actually, it is not really related with NCD, but it is related with nurse in every aspect. Because if we provide care for the patient with warmth, we keep time for them, we be there for them when they have problems, we recognize their value, we accept them as human beings, and the last one, we recognize them as a person. We don't look at them only their disease, only their problems, only their symptoms. But once we do this for our patient, I'm sure every patient will be talk to us, will be share something about their life with us. And once we understand the patient more and more, I'm sure the nursing intervention that we will provide for our patient will be the best for them. Okay? So don't forget to care for them, and more precisely, caring. Caring, you have warm, time, present value, accept the person as a person, accept the patient as a person. This is the core 6C that for me, when I teach my students, I always mention them to have as a nurse. I took from the ICN English Nursing Council, okay? We have to have the 6C. The first one, we have to have compassion. We have to love our patient. We have to love our nursing profession. The second one, we have to have competence. It means we have to have knowledge. We have to have nursing knowledge. If we lack of knowledge, we cannot be able to provide a good care. The third one, we have to have a good communication. Although we have a good knowledge, what we cannot convey our knowledge to patient, it doesn't matter, okay? Next, we have to have the courage. Do you think you have a courage? You have to work, you have to be advocacy for the patient who may not be able to receive the good care. We have to courage, we have to brave on behalf of our patient. And we have to have a commitment. We understand that nursing profession is a tiring profession. It's a hard work, it is true. But we have to have a commitment to our work. 8 hours, 6 hours, 10 hours that we have to be with the patient. We have to put all effort that we have to them. And the last one, everything, it is about care. Care with your mind, care with your heart, care with the compassion. And then the patient will know that you are the best nurses. And once they trust you, they respect you, they do everything that you want them to do. Okay, the front change a little bit. Do you agree with me? Nursing care can change patient situations. They may sad, they may sorrow, they may blue, they may hopeless, they may helplessness. But once the nurse presents, they know that they have a hope. They have a hope to move on with their life. And the last words that I always told my patient is, please make the clients feel fortunate when they see us. Please make the clients feel fortunate when they see us. It means every time when the patient come to us, every time when I go to see them, they are fortunate to meet us. Okay? And now today I have more. Do you think the patient has their value? Can we learn from them? Do we learn from them sometimes? Do the patient tell our story? Do the patient story will inspire us sometime too? Yes, right? So now today I changed my word from please make everyone feel fortunate to meet us, and we feel fortunate to meet each other. So today do we feel fortunate to meet each other? Yes? Okay, so I would like to finish my talk now. I hope you receive something, and I feel very fortunate to meet you all today because it is made me feel happy. Okay? Thank you very much. ขอบคุณค่ะ สวัสดีค่ะ
Thank you. Very inspiring. Thank you, Ajahn O. Now let's open the floor for the question and answer session. Please, students, if you want to ask some question for the both panelists, raise your hand. Okay. Pak Huda. For the first session, I will open for 3 questions. So please tell us your name and what major are you?
Okay. Thank you. My name is Vino. I will ask about community nursing in general. Is okay? Yeah. Okay. My question is, what is the values or selling points of community nursing to be able as a role model? Because nowadays, we can see people without degrees of nursing can empowering the community too. And they have more programs in their empowerment, not just in health quality, but also in economy and etc. And if the values is we can more educate, help, and validate people about health, maybe in 5 to 10 years later, technology, AI, and internet can do too. Thank you.
Okay, for whom is your question? For both of them or one of them? Which one?
Maybe in Prof. Balthip can answer
Okay,
that.
for Ajahn O.
Thank you.
Okay, thank you. Do you want to answer right away? Yes.
Okay, thank you very much for the good question. I think it is very good, and I can see the wide vision of the student who asked this question. It is very important and challenge. What should we do to enhance the people to prevent NCD as a committee? One thing that I always do, because we conduct we call action research. We call action research in the community. Health is the last priority sometimes. Health, they don't concern much about health, but the people concern much about their economics. What do they have to eat? The financial, the income, the occupation. So once we hear like that, for sure, we have to do the thing that they focus first, okay? And try to encourage them to look another dimension in terms of health. If they focus on economics, we talk about economics. What should you do to increase your economics? Oh, you are very good. And do you have anything else that you have to concern in your life? Would you like to look at the neighbor nearby? Do they healthy? If yes, what do they do? But if not, what is happening? So my answer, the quick answer right now and brief short is if the patient, if people in the committee focus on something, we will do something with them first. And then after that, try to move their interest to the thing that we have in our mind. Around 15 years ago, my team and I want to implement about HIV prevention. At that time, people never interested in HIV. So we start with have like a drama first, action first, go to the community to grow the vegetable with them first. After that, 1 year passed by. They change. We can talk about HIV 3 years later. But when we go to the community, the first important thing that we have to have is our sincere heart. We want to help them. After they recognize that we want to help them, they will come to be a partnership with us. So to point now, the first thing, focus on the thing that they really want first, and then try to be their relatives, try to be their friend, try to support them as much as we can. And then after that, we try to move them from their focus to our focus, and after that, finally, it is our focus. First, their focus, Next, my focus. The last, our focus. Okay? Participation, collaboration is the most important. And after we got the heart of the leader, we can change environment. For example, we go to the shop. Could you please sell something like this? Could you please sell something like this? Could you please sell something like that? We go to the shop. And after that, we go to the school, talk with the teacher. Teacher can integrate the health education into their lesson. Okay. After that, we go to the mosque, to the temple, talk about health with the monk, with the leader at the mosque, something like that. So start with the thing that they interest. And after that, we expand to many actors that related with the topic that we want. It takes time, but it will be sustainable. Okay? Thank you very much.
Okay, thank you for the answer. Okay, Bu Ila Mong.
Okay, thank you for the question. I think it's very good question. I try to give some additional answer. I think the people involvement, community nurse have strategies and encourage people. It's called community empowerment. And don't worry that community empowerment will take over the community nurse professional task, because community empowerment is also one indicator that community have good awareness about the health problems around them. So it's good sign that community are ready to increase their health status. Okay. And about AI, I think one thing that can replace by AI is the human touch, and then empathy, sympathy. That's something that cannot replace it by the AI. So you have to remember that people is unique. Yeah, unique. The uniqueness, every people can be approaching by the unique approach that's just community nurse or nurse in a professional career can do it. It's not can do by AI. Okay, I think that's all.
Okay, good. Second question, please. Which one? Yeah. On my left side, please.
Okay, so my question is, what strategies are effective in providing holistic support to single-parent child-bearing families, particularly in addressing the dual roles of caregiver and breadwinner, and mitigating the risk of burnout and mental health challenges? Thank you.
Okay. I assume this question is addressed to Bu Ila.
Yeah, but you both can answer.
Okay, both of you can answer. So what is the...
Can I answer it in Indonesia?
Yes, please.
I'll try to make it clear for you. Okay. Okay, you're asking about single parents? Okay. Okay, single parents. The issues that are related to single parents, I said in Indonesia. Okay. Okay, after this. Issue that are related to the single parent problems is the burden, the double burden, because mother have to role become a mother and also become a father, replace the father role. Jadi masalah utama dalam single parent itu adalah beban ganda yang harus dijalankan oleh, misalkan ini contohnya ibu yang dia harus berperan sebagai ibu dan sekaligus berperan sebagai ayah, begitu ya. And double burden. Nah, as we know that the role of each member of family have their own role. For example, like in the concept that father have the role as the breadwinner, and also as the head of the family. He has key person in the decision making in the family, has to protecting the family, for something like that. Nah, that's tugas yang berat itu otomatis harus dipegang, harus dikerjakan juga oleh ibunya, ya, ketika kemudian bapaknya ini meninggal atau mungkin berpisah, begitu. Nah, so ketika ada satu ketimpangan beban yang tidak balance, yeah, imbalance burden, so it will lead some problems of the family because the mother have to harus meninggalkan tugas utamanya sebagai pendidik, merawat anak ya dan sebagainya. Nah, itu sehingga pasti akan ada imbalance in the duty ya itu. Nah, itu yang seringkali akhirnya becoming problems for the kids or the children karena dia tidak menerima perlakuan atau mungkin kasih sayang sebagaimana yang porsi seharusnya. Nah, however, there are in special case that a mother can be a father too and he can do everything fully ya. Walaupun ini dia bisa mengerjakan semua tapi tetap pada akhirnya yang menjadi korban adalah ibunya karena dia pastinya akan berusaha dengan effort yang sekuat tenaga. Nah, dia harus mengeluarkan segenap powernya, energinya ya untuk bisa menjalankan dua tugas ini secara bersamaan. Dan itu tidak mudah. Walaupun terlihat bisa dilakukan semuanya, tapi pada akhirnya pasti akan ada kekurangan, akan ada yang dikalahkan begitu. Oke, that's all.
Yeah.
Okay, thank you very much for the questions. And may I answer a little bit with the first question too? I forget about talking AI. Like Ajahn said, the teacher said, because nurses are very smart, and we know that we can use AI to help us, not to replace us. Okay, we can use technology to help us, not to replace us. And like a soft power is the most important for nurses. So we still have it, and we have to use it wisely. Yes. And for the second question as well, I would like to relate it with that. The most important thing, I think maybe I would like to add more a little bit because your teacher is an expert already in this area. And as I have experience in the committee and I met a lot of single mother right now, like she may have to play at least 2 roles. The most important thing that we can do more is try to find her inner strength, okay, start from her first, try to find her inner strength and use that inner strength to lead her life, the first thing. And the second tools that we always use as a community nurse, we call ego map. Although the first door is closed, but the mother have another window to support. When we talk about ego map, it means we try to find a variety of support to support her. However, again, start from her first, try to find her inner strength, which part, working part, parent part, calm part, hardworking part, something like that. And her family close to her community who close to her school, her hospital, something else. We try to find a variety source to support her. Okay, thank you very much.
How about the second question? What is your view about a strategy for taking care of the family who is a single parent?
Okay. When we talk about nursing, as I told you, like that, we have a role to encourage them to look after themselves. So when we talk about the nursing strategy to care for single parents, again, try to help them to be able to rely on themselves. Okay, and after that, try to find together, okay, parents and us, try to find the support system to support them. And at my faculty, we have this phenomena about the single mother. We have the like a child development center, so the parents can take their children there. We have something like that. So other thing it is a facilitators to support based on their need. Okay, but the most important is from them. Okay, try to find a job for them sometimes. Like my faculty also high. If we have 3 jobs vacancy, we will set priority for someone who have some difficulty, and also like a single parents is one of the criteria that we give opportunity for them. Yes.
Okay, thank you. Before we move to other question, I would like also to invite participant from online, is there any questions? Is there any question from the online participants? Maybe from the chat room? No? No question? Okay. Let's move to the audience in the hall. Come on, students. Okay.
Check. Okay, I'm really sorry because I'm gonna asking.
Would you please to mention your name first? Thank you.
My name is Alif Zahid Salawatun, and I'm from Class C. And yeah, I'm really sorry asking about this because this is out of the topic. This is special for you, Professor Doctor. I hope this question is represent to all the next generation of the nurse in here, because yeah, being get work in another country is gonna be made you great maybe. And yeah, the question is in Thailand the case of the doctor and the nurse are same? Because in this country the doctor still be in the highest case who always have respect from the others. Yeah, that's all. Thank you.
So you give me the tough question. No government, no policy makers here, right? No, okay. I think, okay, this is come from my perspective, okay? I think, student, the question that you feel, I think some Thai nursing students feel the same. But every time, if we feel like that, we may not be able to perform our nursing role well. The most important thing is we have to be the partnership with the doctor. So I'm not sure my answer is answer or not, but it means the feeling, we may have some feeling of inferior. We may have some feeling of inferior, but at our school, we have to show our students that nursing profession is a nursing profession, that we are important. Without us, only doctor may not be able to make our patient has a good quality of life. We have the different roles. The doctor have the roles of care and treatment. We have the roles of caring. Without our caring, the patient doesn't live well or die well. Okay. As I am interested in spirituality, and I have experience from my own experience. I got a friend from the UK. He's a very smart engineering. He's an honor engineering. He got honor when he studied bachelor degree and master degree and PhD. And he asked me, if you want to change from being a nurse to being a doctor, would you like to change? Because as he want to be a doctor after he graduated. He said that being a doctor can save the patient life. That's why he want to be a doctor. Once he turned to me, because he said that he know that I'm very smart. I'm not kidding, I'm very smart, you know. Actually, how many years to study high school in Indonesia? 3 years, right? And you have to enter to university. In Thailand, the same. We study 3 years for junior high school and 3 years for high school. But for me, for high school, I study only 1 year. And I can enter university. So he know that I'm smart, right? And I'm kidding. That's why he asked me, if you can change, do you want to change to be a doctor? I said, no. Once I work as a nurse and as a nursing educator for more than 20 years. Now I work for 25 years. I said that right now, I never think to change. Because although we can't save the patient life, we can we can make them have a peaceful mind when they are living. And if they die in the caring nurses, they can die well. So I always cultivate this sense to my students. Not only me, our lecturer, our staff try to cultivate this sense to our students. Otherwise, they may feel familiar and they may not be able to work together with the doctor. We work as a team, remember, we have the different roles. Thank you very much.
Okay, thank you. Is there any other questions, please? Please raise your hand. Okay, on my right side. You also can ask a question in Indonesia if you want to. Okay?
Yes, sorry. Yes, Miss, sorry. My name is Ahmad Kusairi. Can call me Airi. In the Prof material, there's in family sport, in family nursing, and Prof said the service called change the patient situation. My question, what does the Prof think about family expressing and CD who don't have family sport and who also don't have the money to go to hospital for treatment? And what should the Prof do, give free help or left in the alone? Thank you.
Okay, you may answer.
Actually, teacher can help you because she works in the community, but I will answer first. Oh, you give me a lot of questions I could not remember. Okay, very good question, and I can see your compassion to the patient. I'm not sure in Indonesia, sorry, but in Thailand, I will come from the big picture first. We have the universal coverage scheme. It means every people in Thailand will receive treatment and care for free. In every sector, we divided into 3 sectors. The first one, the first one, general population, they have the scheme that we call, in the past we call 30 baht scheme. Everyone can receive the care for free. The second one, from the civil society, it means they work in the company, something like that, right? Yes. And the last one, like a government officer, we receive the financial support and health scheme from the government. So every Thai people receive the scheme like this in Thailand. So we don't left anyone behind. However, the point of the person who live alone, not just because the care, the treatment that they have to pay, but they have to find someone to take them to receive the care, and we have to have someone to care for them at home. In terms of taking the patient to care at the primary care center, nowadays, have you heard about health volunteers? During the COVID-19 pandemic, health volunteers play a very significant role in helping the patient, the people in the communities. So once we know that the patient live alone, they have no one to support them, we have the system that help volunteer to help them, to care for them, take them to see the doctor, the nurses at the primary care center, okay? And if they stay alone, we have a schedule. The nurses at the primary care center have to have the schedule to have a home visit. They may go on Monday, Wednesday, Friday afternoon to have home visit. And as a nurse in the community, they have to set the priority who will gonna receive the home visit first, okay? So I hope I answer all questions. So it means we cannot leave anyone behind. We have to have the system, both formal and informal. The one that I have mentioned, it is about formal system. And we also have informal system like relatives. Like, may I refer to the single mother as well? I think Indonesian and Thai culture still have a very good family relationship, family connection. I think because of our extended family, even nuclear family, but we still have the connection among family members. Like my sister have their own family, but she still look after my parents, look after me, and maybe Ajahn, teacher also, you may have your own family, but we still have connected to each other, we support each other. So the first thing, okay, back to the person who close to us, we still have a good family support, although we don't live together. The second thing, we have a very good informal support from the communities, leader, neighbors. And the third one, we have a very good support from our government at the different three levels: general people, civil, and also the government officer. Thank you very much.
Puila, you want to add some more information?
Okay, maybe it reaches the poor until right now, yeah. So maybe if for the president, yeah, at the time of President Soeharto, yeah, health insurance is just coverage for the civil officer, ya, PNS atau mungkin private officer, karyawan swasta saja yang memiliki health insurance, ya. But in stages from the leader to the leader, it expands for almost all of the people, these citizens of Indonesia have. Now it's covering by health insurance, ya. Jadi even though masyarakat yang ada di pedesaan, petani, ya, yang bukan pegawai negeri pun sekarang juga sudah memiliki jaminan kesehatan yang bisa dimanfaatkan, begitu. Itu diantaranya untuk pemenuhan layanan kesehatan khususnya untuk masyarakat miskin.
Thank you. We have also one question from the online participants. What is nurses, family nursing can do to overcome a poor family who are live far enough from the healthcare community? Yeah.
Okay, a very good question. I think for the people who live far enough for the healthcare facilities, I think puskesmas, we have puskesmas, yeah. Puskesmas like in Thailand maybe Roposoto. Oh. Okay. Roposoto. Okay. Sejauh ini puskesmas itu jangkauannya sudah sangat jauh, ya. That's why every puskesmas have puskesmas pembantu, punya polindes. It have something like branch, ya, ya. And puskesmas pembantu ini dia berada di setiap wilayah yang sub, ya, biasanya sampai ke perifer, ya, begitu. Nah, but however, because of our geographic condition in Indonesia is something like that, yeah, it's very awesome. It's very awesome. So dibutuhkan untuk jangkauan yang lebih jauh lagi. Nah, beberapa staff of puskesmas ini dia bisa menjangkau daerah detail dengan melakukan home visit tadi, ya. Nah, routine home visit, sometimes by boat or by traditional vehicle, ya. Nah, they can reach the very remote area, ya, begitu. Nah, or telehealth, yeah. I know that as telehealth, also we can use the IT to solve the problem by telehealth. We can ask the physician or health professional worker in the city can providing healthcare service using this telehealth. Jadi yang masyarakat yang berada di remote area, people in the remote area can give some medicine advising from a physician or maybe healthcare professional who lives in town. So ini juga salah satu provide bagaimana memprovide healthcare services for the people in the remote area.
Okay, is it also happen in Thailand?
Yes, I think I'm very impressed because we have the similar system. I think it means our government try to enhance the good care, good quality of care for the patient who have the different health status, different background, different health economics. Okay. However, I would like to say that in Thailand, we still have a lot of people that need in terms of healthcare. Sometimes when we talk about remote, it doesn't mean remote in terms of area that they live, but remote in terms of access to care. Like in Hat Yai, that where I live, they may live around 5 kilometers from the healthcare center, but they may not be able to access. One thing because they may not have the ID card. This is the thing that happen. They may migrate from another place. So this is the thing that we deal with apart from the remote area that we have to have telehealth, we have to consult online, we have to have home visit, something like that. So this is a group that we have to pay attention for, even though they live not far from us, but they're quite remote in terms of access. So nowadays, as I work in the slum area, now my project conduct in the slum area, we try to help them for adolescents. We try to help them to have education, go to school, education. In terms of adults who didn't have ID card, we bring them to have like a genetic test and try to find and provide them ID card, because without the ID card, they may not be able to access to care for free. Thank you very much.
Thank you. Okay, students, is there any other question? No? 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 Okay, I think that's it for the question and answer session. Let's give applause again to our both panelists. Thank you for sharing your thought, sharing your experience in community health nursing. I think that's it for me as a moderator. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
So, thus the lecture from Mrs. Nur Lailatul Masrurah, Master of Nursing Science, and Ms. Karnsunaphat Balthip, PhD. Thank you for your very good lecture. May all of us get the value and benefit from the lecture. Now we would like to invite the head of nursing department and the head of nursing diploma program, and also Ms. Karnsunaphat Balthip, PhD, for signing the report document and giving the, to the guest speaker. So now, please, can you help? So. To Mr. Edi Purwanto, MNG, and Ms. Indah Dwi Pratiwi, MNG, and also Ms. Karnsunaphat Balthip, PhD, please come to forward. to Mrs. Henny, to Mrs. Ila, and also Miss Karnsunaphat Balthip, please move to forward. To all the staffs and the teacher to take a photo session. So now it's the photo session to all the teachers from Faculty of Health Science and Faculty of Vocational. Please come to forward to take a picture together. The student who asks to the speakers, please come forward to receive the gift from us. The 4 students. Siapa tadi yang bertanya, silakan maju ke depan. Silakan yang bertanya, silakan maju ke depan. And also the 2 students who come to the hall on time. I would like to invite Sabrina Fraza Faharani and also Puji Asri Ningtyas. Please come forward. Silakan nama yang saya bacakan untuk maju ke depan, dan 4 orang yang bertanya tadi silakan maju ke depan. Silakan berjejer di tengah. ke depan. Ayo, Sabrina dan Puji silahkan maju ke depan. Sabrina sama Puji mana? Puji enggak ada. Silakan maju ke depan. For your participation. So please everyone, sit down please. Okay, finally we come to the end of this event. To close this event, let's reciting Hamdalah together. Alhamdulillahi Rabbil Alamin. So well, ladies and gentlemen, thank you very much for your coming and your nice attention. As the master of ceremony, thanks to all the speakers, the guests, the committee, and the audience entirely. May what we have conducted will be useful for us. Ladies and gentlemen, if in guiding this event I made a mistake or offended someone here, please forgive me. Finally, see you on the next event. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Baik, sebelum kalian keluar, mohon perhatiannya ya, karena ada post test. Jadi nanti akan jadi dikerjakan. Mungkin Bu Melisa mau memberikan penjelasan terkait untuk post testnya. Sudah? Sudah di-share? Sudah dikerjakan?